If you are online, can you please identify yourselves?
Speaking. My name is Sophie Cusworth and I'm the Chief Executive Officer of Women with Disabilities Australia, and I'll pass to my colleague Diana. Thanks.
Are you there, Diana?
Thank you. Sorry. My name's Diana Piantedosi, and I am the Senior Manager of Policy and Advocacy at Women with Disabilities Australia.
Fantastic. Do you guys have an opening statement? Do you have an opening statement? No?
Yes, we do. My apologies. We are attending from the United States at the moment. We're here attending the Conference of States Parties to the Convention on the Rights of Persons with Disabilities, and we're experiencing some technical difficulties with the Wi-Fi and being in the same space. So my apologies.
No, that's totally fine. We will persevere.
Thank you very much, and thank you for the opportunity to appear today. Women with Disabilities Australia is the national organisation led by and for women, girls and gender diverse people with disability. We support reform of the NDIS and a sustainable and equitable scheme. Our concern is that this bill, in its current form and at this speed, will harm women with disability and their families. Our submission and supporting evidence paper received more than 70 endorsements from organisations, academics and community leaders with expertise across disability, human rights, law, gender equality, violence prevention and women's health. Many organisations, including the Australian Human Rights Commission, have echoed our call that this bill should not proceed before a comprehensive public gender impact analysis, stronger scrutiny and genuine consultation with the disability community. This bill operates in a scheme where gender inequity is already documented, including by the Joint Standing Committee on the NDIS. We have identified 3 immediate risks. People may lose essential supports when there is currently nowhere else to go. Costs, care and risk will be shifted onto people with disability and their families, particularly women. And the future rules, tools and evidence settings enabled by this bill may reproduce gender bias, further locking women with disability out of support. The NDIS review set a clear sequence: build foundational supports first, then reform access, planning and supports. Yet there is still no confirmed details on the design of foundational supports for adults or how governments will address the gaps between the health system and disability supports, gaps which have been acknowledged by a number of reviews, including the 2023 NDIS review. For example, the NDIS review specifically recommended a nationalised home and community care support program, known as HACC, and to develop a nationally consistent approach for the delivery of aids and equipment outside the NDIS. The review stated that the delivery of adequate foundational support through HACC will make the system fairer for people with disability outside the NDIS who currently miss out on support. It also stated that a system of HACC supports would likely reduce pressure on the NDIS, reduce the risk of deterioration in conditions leading to higher levels of impairment, and support those receiving it and their informal support networks to maintain a higher level of social and economic participation than would otherwise be possible. Yet when we have sought details on the progress of these measures, we have been told that no decisions have been made. Governments must reach an agreement on the design and implementation of foundational supports before changes to the scheme are enacted. This bill proceeds as though an alternative system is ready. It is not. Women with disability will pay the price of this gap in systems through increased isolation, unpaid care, poverty and exclusion, and exposure to harm. Mothers, daughters, partners, and sisters will carry it. Crisis systems and state health systems will carry it later at greater human and public cost. Imagine a woman in regional Australia with an incurable degenerative condition like multiple sclerosis, which affects 3 women for every 1 man. She relies on NDIS supports to keep working. manage daily life, and prevent avoidable deterioration. The government says functional capacity assessments will reduce the need for people to pay for expensive eligibility reports. But this bill creates another pay-to-prove barrier. She must now prove she has exhausted all appropriate treatment options before her impairment is recognised as permanent. Medicare funds only 5 subsidised allied health sessions a year. Treatment options and specialists may be unaffordable or unavailable locally, but the need for reports is not removed. She needs evidence to prove which treatments she has tried. She is locked out of support for an incurable condition because she can't afford the pathway to proof. Without support, preventable deterioration accelerates. Or imagine a woman whose social and community participation support is the only regular contact she has outside home. It helps her to attend appointments, access community, and be seen by people who know when something is wrong. For women with disability, community participation is a safeguard. Under the bill, this category of support is reduced without regard to her circumstances, and her isolation grows. She is forced to rely on informal supports that are unsafe. The risk of violence increases and becomes easier to hide because she is isolated. These are foreseeable risks under this bill. We urge that the bill is delayed until 3 things happen. Foundational supports are available, fully funded, accessible, and safe. Government publishes a comprehensive gender impact analysis, and there is independent public testing that these measures will not increase exclusion, unpaid gendered care responsibilities, violence risk, or preventable deterioration or crisis. Women with Disabilities Australia stands ready to work with government on reform that is sustainable, evidence-based, and safe. But the choice before Parliament is simple. Take the time to get this right, or rush reforms that may deepen harm for women with disability. Thank you.
Thank you very much. And we'll go to Senator Steele, John.
Thank you. Thank you both for taking the time to give evidence today, all the way from the US. My first question is, just so that we have it clearly on the record for the committee, in the absence of those 3 actions that you have outlined, your recommendation to us is that the bill not proceed.
Thank you, Senator. That's correct. WIDA's position is that the bill should not proceed before a comprehensive public gender impact analysis, stronger scrutiny, and genuine consultation with the disability community.
And from your opening statement and from your submission, can you tell us about concerns that you have in relation to the way in which this bill might increase gendered violence towards disabled women?
In a statement to the Disability Royal Commission, there was some moving testimony from a childhood friend of Anne-Marie Smith. And Anne-Marie Smith is a woman who was an NDIS participant who died as a result of gross neglect. And this testimony from her friend was someone who she had lost touch with a year before her death because they had a falling out. And she spoke about carrying guilt because she hadn't checked in on her. And I think about this because we've all had friends like this. We've all had falling outs. We've all had moments where we've lost touch with people. And we need friends like this who notice when we're missing, who notice when something's wrong. Our safety depends on connection. And some of the most important safeguards that we have are not a particular formal service. They're the everyday relationships and friendships that come from taking part in ordinary community life. These are the connections that allow women with disability to build trust and to be known beyond segregated settings. Social and community participation is an essential safeguard to prevent violence. These supports are investments in the conditions that make violence easier to recognise and escape, and to be meaningfully included in community life. So the proposal currently intends to cut those by at least 50%, and that is a significant risk that we feel is not going to be borne equally. It's going to be women and gender diverse people who are put at significant risk.
So just to be clear, in the view of Women with Disability Australia, do you believe this bill will harm disabled women? Sorry, we didn't quite catch that.
Absolutely.
Thank you. Now, can you share with us how the new definition of parental responsibility will impact women, and in particular, disabled women?
Thank you, Senator. We believe that the bill risks shifting greater responsibility onto families, and particularly mothers, with the expansion of what is considered parental responsibility. The NDIS Reform Advisory Committee has identified that the provisions in the bill impose a comparator test that is inconsistent with the individualised needs-based foundation of the scheme. The committee has received a number of submissions identifying the impact that these changes would have on parents, including parents and mothers with disability. We know that this too will have gendered implications and disproportionately disadvantage mothers with disability. And this is an area where we believe that there should be a comprehensive gender impact analysis to understand the extent and the scope of that change. What we do know is that many families and mothers, including mothers with disability, are already at breaking point due to inadequacy of support. And a parent should not be expected to fulfil the role of qualified, skilled support workers or therapists. They should be able to be a parent.
Thank you. We heard yesterday from CIDA, Children and Young People with Disabilities Australia, that in conversations they've had with the department around the power within the bill to require a disabled person to undergo and exhaust all other treatments before accessing the NDIS, that the department confirmed that medications are within the scope of what could be potentially required. We heard from the Commissioner for Disability Discrimination, who gave evidence before yourself, that there is a concern that this could empower government to require things like menstrual suppression before you access the NDIS. Are you concerned about these parts of the bill and the powers that they might give a government, this government or a future government, to require disabled women and girls to undergo medical procedures or take medications that are not their choice nor the recommendation of their treating health professional?
I think there are some really valid reasons why people may not choose to undertake treatments, and I want to pick up on the example Sophie used before about a woman with MS. So some of the disease-modifying therapies that are used in MS have significant daily side effects and can weaken your immune system. So some people can't tolerate them and don't get used to those side effects. So they have to weigh up the long-term benefit of preventing future relapses against the life-limiting impacts of medication. So the decision to avoid Medicaid could mean that their disability is not considered permanent despite being a degenerative and incurable condition. There are also significant risks to continuing those disease-modifying therapies while trying to get pregnant. So under this bill, it's not clear if ceasing treatment to start a family would then impact recognition of permanence. I think the issue is exactly how appropriate is defined and whether or not the treatment is available, affordable and safe is the biggest concern that we have. Sophie's already spoken in the opening to there's only 5 subsidised allied health sessions a year, the impacts of geography and poverty. So I think the combination of the unknown of how appropriate will be defined, along with those access and affordability barriers, is a significant concern to us.
And is it a concern for you that in the legislation, as is currently drafted, the government explicitly does not have to take into account either financial affordability or availability or cultural context when determining whether something is appropriate?
Absolutely. It will cause significant harm. And I think it also overrides the recognition in previous administrative tribunal decisions of the reality that we exist in. If supports are not available, affordable, if they don't exist, you can't allow a person's disease trajectory to accelerate, or for them to live in conditions that could be significantly remediated with access to disability supports. It's a significant wind back.
Thank you. I'll pass back to the chair at this point. Chair.
Thank you very much. We'll go to Senator Askew.
Senator Little, actually, I think. Thank you. Yes, it is. Thank you. You mentioned that you do not believe that this bill should proceed, and you actually outlined some of those risks. I'm interested in you identifying what needs to be done to minimise the risk and harm, and are those risks of harm inevitable outcomes of the bill if it were to proceed in its current form, or are they contingent on how it's implemented?
Thank you. I think it's important to note that the risks are not confined to just one area or provision under the bill. I would say that the biggest risk that we see is the sequencing of these reforms, and I do think that that is inevitable context if the bill proceeds in the absence of alternative disability support systems. The bill narrows access, enables support reductions, and delegates major future decisions before foundational supports, safeguards, and gender impact analysis can be conducted and publicly tested. And we believe that that sequencing exposes women with disability to avoidable and foreseeable harm. And we have repeatedly said, as many other advocates have said, no one must be removed from the NDIS without proper functioning alternative systems of support in place.
Can you explain why the current eligibility reform is not safe, and what conditions in practical terms do you believe would make it safe?
Thank you.
My apologies, we're having some additional tech issues. We're just resolving those currently. May I ask if you can see Diana on screen when she's speaking?
But no, mostly we can see you.
I'm sorry about that.
But
All right.
She pops in occasionally, I think, but we are hearing her quite well.
Excellent. All right, we might proceed with that then. Thank you.
Okay, so the question was about why we're concerned about functional capacity assessments and what would need to occur to make them safe. Is that right?
Yes.
Sorry?
Yes, what practical things would need to occur?
So I think it's the biggest risk at the moment is that the definition of functional capacity has been implemented before the assessment tools, thresholds and safeguards have been designed. one of the things I was concerned to learn about at Senate estimates recently was that there is a dollar figure already attached to the change that this definition is expected to bring in. I believe it was $9.3 billion. My understanding was that the technical advisory group, which I understand is predominantly going to be medical experts and is not expected to include advocates. And this group has not yet had an opportunity to inform that operationalisation of the definition, but it already has an expected saving forecast attached to it. So I think with that in mind, it's concerning to imagine how this technical advisory group can achieve that projected saving when the evidence that we're hearing from the allied health and medical experts is that these functional capacity measures have to reflect the biopsychosocial model of disability that fundamentally includes environmental, contextual and social factors. The Occupational Therapy Association of Australia recommended that in their submission to the inquiry. So I think there's significant risk with removing those factors and moving back to a medical model of disability. And then even if we do accept some kind of medical model of disability, if we look to the NHMRC, who introduced requirements from 2026 for grant applications to consider sex, gender and variations of sex characteristics, even the NHMRC are noting that these variables influence a person's experience of health and illness. So including how conditions develop, symptoms, disease progression, how their responses to treatments and outcomes. So whether we're looking at it from a social model of disability and we're engaging allied health experts in that technical advisory group, they're telling us that there's something wrong with this definition of functional capacity, or whether we're throwing out the social model of disability and moving to some medical model. The NHMRC are telling us that we need to consider sex, gender and variations of sex characteristics as one example of how health and illness and conditions develop. I can't see how a technical advisory group is going to be able to operationalise that definition and do anything other than find ways to remove people from the scheme.
Do you think the current level of red tape and regulation in the scheme is appropriate, or is it necessary for an independent review to reduce the unnecessary burden on participants and with that unnecessary cost?
Thank you. I think that's a complex consideration given the various remits within the scheme. I will say that we have most certainly heard about barriers imposed by administrative processes, administrative burden and red tape for things like seeking a plan reassessment or a change of circumstances. We understand that many participants have waited incredibly long timeframes to seek a change of circumstances process, including, for example, in the context of gender-based violence. So we have heard from members who have been experiencing gender-based violence and have sought a plan reassessment or a review of their supports in order to leave violence. And that process has taken months. And during those months, they have stayed in a violent situation. I think that is one example of where there is a significant piece of red tape or administrative burden. But I will also say that we hear continuously that the administrative burden of engaging with the scheme in order to get one's support needs met can be quite immense.
Thank you. Thank you, Chair.
Thank you very much. We'll go to Senator DeLiga.
Thank you very much. Thanks for joining us today. I understand that you've previously spoken about the regulation of disability providers and how it could support the rights of people with disability to be safe. Are you concerned about the quality and safety of some supports in the system right now, and how would a registration model improve that?
Thank you. I think our position to the provider task force really grappled with the nuances around safety and quality, as well as choice and control, and said that these things are not mutually exclusive and that we need a proportionate system that perhaps recognises the importance of visibility of providers, that recognises the critical role of quality and safety, and also the critical role of individual choice. I would say that a participant needs to be involved in assessing risk, and that risk needs to be assessed from a human-centred lens. Diana, was there anything that you wanted to add?
I think you've covered it really well. It's a proportionate approach to managing risk is the most important thing, that also recognises the complexities of the thin markets that we grapple with people being dispersed as widely as they are in Australia. We have a significant population of regional, rural and remote people. So to make wholesale changes to the registration process could leave people without supports, and that would exacerbate those harms that we're actively trying to prevent. So I think the working towards a tiered model that is able to preserve the choice and control aspects that sit at the heart of the NDIS, and making sure that any changes that are implemented happen gradually enough that we're not impacting the already thin markets that we navigate.
Thank you.
Thank you so much. We really appreciate.
Just one.
Sure.
Thanks,
Senator Steele-John.
Thanks. Just one quick clarifier for you. In the budget, the government committed 15.9 million to Australia's DROs, of which WIDA is one. About 6 million of that is ongoing funding, and there is an element of it which is kind of slightly flexible and not quite ongoing. But the purpose is to support community engagement on the design and implementation of reforms, with the costs to be met from other line items in the budget. Was WIDA in receipt of any of that money? Did any of that go to you?
Thank you, Senator. At this stage, no, we don't have information. WIDA will be a recipient. We haven't received funding under an ad hoc additional funding amount for community engagement. We have had our disability representative organisations based funding confirmed for the next financial year.
Okay. Has the government met with you to discuss this additional funding, and when it would be required, and what would be required of you or other DROs?
No, not to my recollection. I will note that I have been on leave for the past 2 weeks, but to my awareness, no, we haven't received detailed information about that.
All right. If you could just take on notice how much Commonwealth funding you received in the 25-6 financial year, that would be most appreciated. I'm sure you don't have that off the top of your head.
Thank you, Senator. Will do.
Thank you very much for your evidence today. We particularly appreciate you both joining us from quite so far away. You have taken something on notice, and we do require the response by Friday the 12th of June, because we are reporting on the 16th, and to ensure that we reflect your evidence. If you have a problem with that, please contact the Secretariat and we'll see what we can work out in terms of maybe amending whatever might be required. Other than that, thank you so much, and we'll leave you to your conference. Thank you.